Hey, everybody.
Hi, Dr. Zach Watkins here, Livewell Clinic founder and functional medicine doctor. I'm here with Christina, our operations manager, and we wanted to start a series and start discussing just health topics, things of importance, and communicate more with our community and talk more about us and talk about more about you and your concerns. So we wanted to kind of kick things off and talk that October is Cancer Awareness Month. So I know we're going to be speaking over the next coming weeks about cancer and what it is and maybe things we can do to help support our health. But I thought we'd just start today and talk about a few common questions that we get to us from people like you asking about cancer and things that we can help with, and maybe even things that you can do proactively. So I know we got some questions.
We do have some
sharing.
questions planned, and obviously many of you have expressed the fact that even though we have a lot of events here at the clinic, that wouldn't it be nice if you could actually engage with the clinic without necessarily having to come here in person. So we're trying this out, and we thank you for your feedback on that. That also means if you have questions or comments, or if you're there and you're watching, we're paying attention to that too, and be happy to answer some of those additional questions as they come in. But to start with, we do have a few, as you mentioned, that people have commonly asked, and so we can start with those and then see if anybody else has anything to add. All right, so firstly, and this seems like such a simple, I guess obvious one to some people, but what is cancer anyway? What is it?
Yeah, I think to keep things simple, we talk about cancer is typically, you're looking at cells that normally when they're healthy, they divide. Mitosis is what it's called, to keep it fancy. But they split, they divide, they grow. Ideally, we have an optimal body environment, health environment. And when the cell kind of reaches age, if you will, it naturally dies. There's a process in the body where it naturally dies. And that's good. What happens with cancer is that process of aging and naturally dying breaks, if you will, and these cells just keep dividing and they keep dividing, and there's a process in the genetic code that it's to tell it where to stop dividing, and if it doesn't, you're going to keep growing, and this is where we hear about tumor development, because these cells start growing and they tell the body to make more, and they keep developing and growing from there. And so that's just kind of the start, but as you know, as that develops, that's going to lead to chronic disease, things that we hear like the word metastasis, and so that's kind of the development, just from an easy, simple perspective. Obviously, there's genetic components and there's lots of other things which we may mention, but just to keep it simple, that's kind of the process that goes on.
Okay, and what it is.
Yeah.
And so why do people get it, just broadly speaking?
Why would maybe cancer develop? I think when you look at the body's natural environment and you look at how the cells naturally develop and divide, your genetic makeup is kind of swimming in what we call the environment of the body. So from a functional medicine perspective, we're interested in the environment, basically meaning if your DNA and how the cells develop and reproduce is in this environment that is unfavorable, that's when it kind of turns these cancer processes on. So environment meaning predisposed genetic makeup, but also inflammation. Inflammation is like a fire inside the body. Think of flames that are turned on that basically kind of rev up the disease process. And when we say disease process, that can be anything from cancer to joint disease, joint health. I mean, it can be wide range, but this inflammation is what can trigger that genetic marker and makeup to keep going. And so that's what's involved in the environment. We talk about maybe dietary influences, what diet does. I may mention this later, but cancer loves a sugary environment, and there's reasons why. I don't want to jump ahead, but
You can go in whatever order, it's fine.
Yeah, okay, so cancer has these gates, if you will, that can let food in, like sugar. They love sugar. And sugar kind of makes it grow and develop, if you want to call it like that. So it loves an environment with less oxygen. It loves an environment with more sugar. And these gates allow that to happen. So going back to diet, if we have a diet that's more promoting of inflammation and more sugar, not just like sugar as we think of candy, but just maybe more of a carb-based diet, these cells can take those processes and feed cancer. And it is kind of frustrating, I think, sometimes in our own clinic when we see patients here trying to support their health at the same time. They may still be using higher sugar foods to feed their diet, thinking that cancer is cancer, treat the disease, and what I do separately has no impact. And so those are just some examples of the environment. Think of your surroundings in the body that can turn these things on. And the cool thing is you can control the environment in the body, meaning, yes, we may have genetic makeup like a light switch, but we can do a lot of things to control, does the light go on or off, especially like what our diet does, what our hormones do, what our sleep patterns and stress levels do. So this is what more functional medicine practitioners do. They look at what's an individual's overall health and impact to themselves that can flip on or off disease.
Yeah. And I know a lot of times when people think about cancer, they think primarily about family history and not as much about other components that you're describing.
Right. And family history is extremely important. So we, even in a nutrition-based practice, we want to know history. Where do you come from? What were the insults mean? What was your life like? How was your birth? What was the stress patterns growing up? But genetics is a lot of it. It's like saying, well, if it runs in my family, runs in the family genes, that's important to know and to think about, but also keep in mind that your environment just if it's in my family, I need to be more aware of certain things maybe than you may be, and therefore that's what we got to take in consideration. Everybody's different. It's hard just to label, I'll just say disease, including cancer, as a single entity that we treat from the outside the same. What's each individual doing that we can impact separately?
So broadly, if someone were to say, how can I prevent cancer, or is cancer even preventable, which seems like, a little bit of a loaded question,
yeah.
Would you say? What would your response to that be?
Full disclosure, we're not giving medical advice, so...
There you go. We're on Facebook Live.
We're not giving medical advice. Check with your doctor. So cancer is preventable. The CDC says, at least from last year, out to last year, that most cancer is about 80% environmental, which is a lot. Environmental meaning what's affecting us outwardly, which is a lot. And you're talking about toxins, you're talking about stuff in our food, the air, hundreds of thousands of chemicals. New ones are released every year into the environment, which obviously runs back into our water. And, so when they talk about being preventable, there's all of those aspects that we want to look at. So is it preventable, yes or no? I would say probably depends. And that's why I think a clear understanding of each individual person, if you are someone evaluating your own life, it's what am I doing in my health and my disease, or my health path in life to prevent disease in general, but also cancer, because it's been shown things like BPA and plastics, that is a trigger for disease, also cancer. That's in anything from water bottles to the lids in your coffee at your local favorite coffee shop. So FYI, take your lid off when you drink coffee because you're leaching BPA in your coffee when that heat rises. Stuff like that. So yes, as things are more convenient as we go through life, but at the same time I think it's becoming more dangerous at the same time because our body is now just up against so many more threats that we need to take action against. So that's where I think it's preventable, is evaluating yourself, evaluating each person, and mind you, this is maybe before onset of some kind of disease, and saying, if we're going to optimize someone's health, it's got to be more than just, I eat a paleo diet, or I take a multivitamin every day. There's more to that, and I think it's encouraging and worthwhile to think about what's the situations in my life that I need to improve. So that's
Well, and I think too, because we all know people that are healthy that at some point develop cancer, and so it's this different definition of what healthy looks like.
Right.
That we talk a lot about here, and then there is a personal burden and responsibility when we have information to change those behaviors, because if it is preventable, then we can change what we're doing to help that.
Yeah.
I didn't know the coffee thing, by the way, and I've been around you for a while, so I will be taking my lids off.
Yeah. We were at a lecture once, and we're sitting in the front row. Everybody's got the coffee, and he's a well-known immunologist and studied the immune system. And before he even started, he's like this grumpy grandpa that was yelling at us to take our lids off, and we didn't understand why. And he said, "Look, I do so much research that this is now a new problem for society. It's BPA, it's plastics, and stuff like that." Anyway, but you mentioned information. I think information is key. I think everybody needs to be. We always say proactive versus reactive. It's more, I think, we hear these people develop, let's just use things like cancer, develop, we say out of nowhere, or as a healthy person, develop something. And this isn't to belittle anybody or their situation. I could very well have something right now. I think you look back and you say, well, with information, what can I look at my own life to say, am I doing things proactively? Do I need to evaluate my environment, including stress levels, including sleep, including diet? Because if those things didn't work, I say you got to start working.
I've, by the way, been going to bed 1 hour earlier every night this week. We may have had a discussion about sleep earlier, a little while ago.
And who doesn't get it?
And me. We're all working on something. By the way, for those of you watching, thank you. We love your questions. So continue to give those questions and comments if you have them. So we see cancer patients here at the clinic, and I think some people may or may not know that, but maybe talk a little bit about what kinds of cancer patients we see, why they come here as an option or as part of their care. Yeah,
we do see them for multiple reasons. I would say it's the individual who, and again, this isn't to belittle anybody. I think we're all faced with health crises at one point or another. But I think it could be the person that says, I've been diagnosed with something, I need to reevaluate life and reevaluate what I'm doing wrong, which is very, very typical. So we do see them, and we also see people who are pretty maybe far advanced in the actual cancer process. And they may seek us out for things like higher dose nutrition, like IV vitamin C, which the research and the literature is very positive on that. So I think if you're looking at conditions too, or just the types?
I think, whatever you want. You obviously are more well equipped to speak to this, but both maybe.
Yeah, I think what I don't want people to think of is, I'm healthy, unless I feel it. I've been diagnosed with something. Oh no, now I need to figure it out. So they may call, and this goes with cancer or any other kind of diseases. Hey, I have this condition, I have XYZ. Can you help? Can you help? We always say here in our office, from a nutrition perspective, if you got a pulse, we can help. But that's where each individual is different. Where you at in the stage of the game? What's your lifestyle like? And it's a change of pace for people, but I think that's important. I mean, knowledge is key, and if you know what you're dealing with and know what to fight against, I think it makes the battle doable.
So some people might be coming here because they've had cancer and they want to do whatever it takes to prevent that cancer from coming back. Now some people come here and they have cancer right now. They have a diagnosis.
Yeah. And
you alluded to vitamin C earlier. So maybe talk a little bit about what's happening there with those cancer patients, why high-dose C works for them, maybe the mechanics of that for a little while.
Yeah, we always talk about, we're not necessarily in the business of treating specific diseases. Like, I have XYZ disease, what kind of protocol, vitamins, whatever do you have specific for that? We look at you as an individual and say, what things are not optimal to allow you to flourish, and how can we fix that? So that goes with cancer. Obviously, the body is struggling for some reason, whether it be the immune system, whether it be that's the main thing. But what are things we can address to support that? Nutritionally is a big one. I think they seek out vitamin C because a lot of them are knowledge. They've heard about vitamin C therapy and the benefits of it. Vitamin C would be more. We're an a mammal that doesn't make vitamin C. A lot of mammals do, so they can combat the biggest stress to the body. You may have heard of adrenal fatigue and adrenal stress. The more stress we're under, the more we deplete things like vitamin C, which are basically your support to go through those times, to help you build up and nourish. So if we don't really get it, I mean, this is more than just your little effervescent daily thing. You're looking at an immune system and a stress response that gets more and more burdened and overwhelmed, and long term you're faced with a disease process. So bringing in vitamin C, we study with a clinic of our friends of ours who are south of us in Missouri, who are known worldwide for vitamin C research. If you guys have heard of Linus Pauling, he was kind of the godfather of orthomolecular nutrition, studying how the nutrition affects the body, especially vitamin C. Won Nobel Prize on that. These guys are kind of descendants of him, mentorees and things like that. So we've been studying through them, and the research has been phenomenal. Like I mentioned before, cancer has these gates. Cancer cells have gates that allow food, sugar, and glucose. Well, the cool thing is vitamin C looks just like glucose. So what happens is these cells take in the vitamin C as for food, but it actually starves it to death. People who get vitamin C here will prick their finger after getting vitamin C, and their sugar levels will be in the high hundreds, and people get nervous. But it's just because the machine thinks it looks like sugar, but actually it's not. It's just a very high dose of nutrients that combat a process like cancer. And not only that is it's helping the body's stress response, it's helping them cope with fighting a battle in all diseases, but especially cancer.
Cool.
So, yeah, the research's been great on that. I think that there's a few cancers that the research is probably best at, and that's kind of like in the colon and breast areas. But I think when you look at individuals and a disease process, we want to do the best we can for you, and so that's part of our repertoire that we use a lot.
How about screening that might be available? So I think people are familiar with things that they have done with their primary care practitioner, but what do we use here that might be different? Yeah,
screening obviously is important and huge. There's colonoscopies and mammograms and thermograms, all of which are very, very valuable. We use a lab that is fairly new through the research. I think a lot of people have heard of like genetic testing, DNA testing, 23andMe, Ancestry, which I just got mine back. That's all very, very cool. It's cutting edge. They're even looking at the DNA of the bacteria in your gut to dictate how you process medicine. So a lot of cool stuff on the forefront. So the lab we use, there's a company called IV Gene. So IV like the plant gene. And what they've shown is basically that in cancerous cells, there's a process going on that, how should I say this? There's a protective mechanism in cells that are normally. And in cancer cells, that protective mechanism is lost. And when these cancer cells die and turn over in the body, they release these genes in the blood. And what they're finding is they can actually test and find these genetic codes floating around in the blood, and they match it up to normal cells, and they can see specifically kind of where at there's probably tumor or cancer development. And they have validated this with 4 specific cancers: breast, colon, kidney, kidney, lung. Yes, thank you. And lung. So those were the ones validated. They're about 90% specific, which is pretty high. And now other cancers, they say it's not been validated yet in the research, but they would say if you have a strong, high response on the testing, that we got to figure it out. If it's not those top 4, then we need to figure out where the body burden is. So it's used. We don't want to use the word screening because technically we don't. It's not really used as a screening lab, but I would say that if we look at an individual with a lab and there's a high level, there's a high response, if it's not from a burden in these top 4 areas, we want to say, okay, the body is obviously under some kind of metabolic stress based off other lab work, based off environment. What else can we do to combat and support? So from a functional perspective, it's not necessarily, aha, I uncovered the whole problem. It's more, you're on the wrong path. And the cool thing is this lab has basically given us, for sure, 4 options that can be very specific. If it's not those 4, then that's still fine, because we want to know metabolically, how can we support you? How can you support yourself? What changes can you make? So from a screening perspective, we use that, but also we talk about referring out if we need to, obviously, with things like thermogram, mammogram. So it's all encompassing evaluation of someone to see where you're at, where we want to take you, and how can we get you there faster.
Yeah, and I know we'll be talking more about that test in the coming weeks.
Yeah.
I think we're having increased levels of interest in it at the clinic.
Yeah, it's used in multiple clinics across the country and some research institutions and hospitals, because they're finding a lot of value in this DNA genetic ability to study and see where this potential cancer development is. So it's exciting, and that's why we want to do things here at the office, because it aligns with what we do: proactive, preventative. So it's just another tool in the toolbox that we use.
Yeah, and it's almost in addition to a lot of the other things that we do, I would say. What, and maybe this is all things we've already talked about, but what might someone do differently based on the outcome of that test?
I think differently, it's when you have knowledge, it gives you a reason to pursue kind of a path. And if we are to see an unfavorable situation in someone, we can sit down and say, okay, we need to change this environment, because how I mentioned, the environment can turn on this cancer development, disease development, but cancer development. So do we know where it's at specifically, like I mentioned? What's the state of the body that it's at now? What can we do to basically fight back, honestly? What things can you do to make your body go from here to here? And most people have things that we need to deal with and work on. So I think giving people a plan is what is important. If we just say something's not right, change your diet, good luck, we'll see you in 6 months. I mean, I think that's not helpful, that's stressful, that's not doing our job as helping you as an individual, helping them make change. Because the body can change pretty quick, the body can change well. I think it just depends on where in the stage of disease you may be.
Yeah, and for some people, that having that information is a different motivation. I mean, a lot of people know they should eat healthy, but when they see certain information in their labs or whatever, it just tends to be one more nudge in the right direction.
Give me a reason why I need to make change.
Yeah.
Give me a reason why I got to eat differently. Give me a reason why I got to spend $4 more for grass-fed beef. Stuff like that.
Sleep more.
Sleep more.
We do often get the question around, how will other doctors in the community, my oncologist, if I have cancer, how will they work with me, or how will this work along with some of the other things I might be doing? So can you speak to that a little bit?
Yeah, I think it's tricky sometimes. I think we want to support people no matter where they're at in their journey. And having a team is important versus having enemies. I think there's a lot of great research with identifying, a body state and using things like nutrition to combat diseases, especially cancer. I think we really hope and rely on the patients themselves to have these conversations with their providers to say, look, we've identified a problem. I want to make some changes, and you're on my team. Maybe this clinic's on my team, and we all need to be on the same page. And I think there's a lot of providers that are very open and interested, because we have the patient's outcome in mind, their objective, their health. So I think it's important to be on the same page versus trying to sneak and not do things that other providers may not want. For instance, like chemo and cancer. I know there's been a lot of backlash about, well, vitamin C makes chemo not work as well because it actually makes you healthier, kind of, which, but actually the literature that has been done actually showed that it can actually support chemotherapeutic agents. Not only that, but patients feel way different after, let's say, they're using chemotherapy. Their body can recover better. They're not out for a week and can't function, and they have fatigue. We want them to thrive, right? Even if they have to do mega dose of different medicines. That's one of the big responses I think we get from patients is, you know what, I feel good. I can maybe recover quicker and feel stronger, and I think that's important, no matter what kind of treatment or therapy that we're doing.
Yeah.
So.
I don't see any other additional questions, so closing thoughts on this topic before we kind of let everyone go?
Yeah, no, I think just be aware, October is Cancer Awareness Month, and knowledge is power. Do what you can to read and learn. There's a lot of good information out there. Think of cancer differently. I know this is about cancer, but also other diseases, but think of disease development differently, not just passive, I live life and things develop out of nowhere, or where did that come from, or where did this come from. Think about how you can be proactive in your own self to prevent and to support disease process. Cancer, people walk around all the time with cancer development, cells turning over. Luckily, the body may be strong enough where it can get rid of them. Other people, their immune system is struggling, and they don't know it, and it just develops and goes and goes and goes and goes. Well, by then you're talking about a lot of time that we could be wasting. So be proactive. Knowledge is power. And if there's questions ever, always post here on online, or send them even to the office. And I think we just have a team that's willing and wanting to answer questions. But also stay tuned, 'cause I think we're going to try to communicate and talk every week.
11:30 every Thursday.
Newsletter. We try to do what we're up to and how we can support you more.
And a big passion of ours is education. So in addition to things like this, a lot of you know to go to our website, which is the livewellclinic.com. We have our introductory classes, which give really a high level of what we do and why we do it, and how you can be a part of that. Certainly people come here because of cancer concerns, but lots of other reasons too. So autoimmunity is a big one. So whatever it is that you need from us, let us know. And we thank you for your time.
Thank you very much.
Have a good day.
We'll see you next week.